Well, we're taking a break from cooking now to talk a little bit about women's health, and Dr. Jeremy Bell is here from Affinity Healthcare. He is an OB/GYN. Good morning.
Morning, how are you?
I'm great, thanks for coming. First of all, we want to talk a little bit about your practice and what you do and what sets it apart, makes it different from some of the others out there.
Well, we provide comprehensive OB/GYN care for women of all ages, and that includes routine prenatal care, gynecologic visits, annual exams, pap smears. In our practice, we have 4 physicians as well as 4 midwives.
Now that right there I thought was really unique. Why, do that? Why is that important?
Well, I think that the midwives offer our patients a different aspect that physicians don't. The midwives, the patients who come to see them want a more natural approach. And the midwives tend to labor their patients through the entire labor and tend to spend a lot of time with the patients in the room, which we do as well as physicians, but sometimes with our schedules, the midwives have a little more time available to be able to spend with patients. They also offer in the delivery room something we call water bursts, which is a more natural way to deliver the baby in the tub with the warm water swirling around the mom's abdomen or belly, and it provides soothing care as a pain control option rather than medications or epidural medications.
I've heard a lot about that, and wish they had that back in the day when I was going through all that. I've heard wonderful things about it. Speaking about wonderful things, a lot of the surgeries that you can do these days, you can do with robotics. Let's talk about that, and you guys are big into that at your practice.
Yeah, in our practice, we, myself as well as other physicians in our practice, specialize in minimally invasive surgery, which would be traditional what we call laparoscopic surgery, which is through small incisions in the tummy rather than a large incision to perform different procedures. And nowadays, with increasing technology, we have robotica surgery available, which is called...
You do at Mercy Medical Center in Oshkosh?
We do, and I've been doing that for about 2 years, initially at our sister hospital in St. Elizabeth's Hospital in Appleton, which also has robotic surgery available. And now we have a Da Vinci robotic machine as well at Mercy Medical Center in Oshkosh, where we can perform these procedures. Now, the different procedures that can be performed through these small incisions can include hysterectomies. We also perform prolapse surgery, which is where pelvic organs tend to fall down as women age and their muscles are not as strong as they were before childbirth, so the uterus can prolapse, the bladder, the rectum as well, and different procedures can be performed to help with that, which can create health problems for women, including pressure and pain sometimes because of prolapse disorders.
I think a lot of people too, when they hit middle age, think that that's just the way it needs to be, and it doesn't. There's a lot of things that you can do. The recovery time with this robotics,
much quicker. Through an open procedure where we did a large 4 to 6 inch incision in someone's tummy, you're talking 6 weeks of recovery time, whereas with robotic surgery or minimally invasive surgery, that recovery time's cut down to 2 weeks and only 1 night in the hospital. Wow,
that is huge. So if you're thinking about getting a hysterectomy or some of the other things that Doctor talked about, or maybe you're looking for a good OB to get you through childbirth and you've always thought about doing a water birth or having a midwife along with you through the process, people can contact you and get a hold of you and the other doctors. How?
Well, we can be called at our office, which is 920-223-0220 is our office number main line. And we can also go to affinityhealth.org and look up any of the doctors or the midwives. We have web outs on the internet where you can actually see the doctors talking live and learn their personality as well and what they do.
Very cool. So a lot of those procedures that they just used to do in the big cities, they're doing them right now in Oshkosh.
We do it right in Oshkosh in our small community.
Very, very cool. Thanks, Doctor. Appreciate it.
Yes, very nice meeting you. Thank you.
Coming up, we're headed back to the kitchen to do some more cooking, so stay with us.